Hello, my name's Phil Langridge. I'm the lead physio for the National Aspergillosis Centre here in Wythenshawe Hospital. And I've been asked to talk to you about physio in the Aspergillosis service. So I thought I'd split this into a little bit by me giving a bit of background to the service, and then my colleague Mairead can tell you a bit more of the nitty-gritty about what we get up to. Okay. The Aspergillosis Centre here was commissioned in 2009. It didn't have physiotherapy attached to that to start with, but a year after we started work, they managed to appoint me as the physiotherapist for the service. And the idea was that I would work with the team on the Wednesday afternoon clinics and the Friday clinics to make sure that when patients came from all over, so nationally and sometimes internationally, if they needed physiotherapy input, then we could provide that then and there. Because sometimes it's a little bit more tricky to get people seen by physiotherapists closer to home. As the years have gone on and the service has grown and developed, we've managed to increase the amount of hours of physiotherapy time that are attached to the service. So we now have 1.5 whole-time equivalent physios. So that's myself and Mairead Hughes. Physiotherapists sometimes won't have been seen by patients when they're sent to me in the clinic. So there can be a bit of confusion about what physiotherapy is and what it does. And this talk isn't really about what is physiotherapy. Generally speaking, physios will be trained to at least a degree level because it's a protected title. So people who call themselves physiotherapists in our country, they have to be on a register, which you can check. So there's at least 3 years of degree level training and sometimes master's degree training. And then at the core of what we do, it's really optimizing function. And that means getting the best out of what you've got. And we might use physical means, which is probably how physiotherapy started off. So things like manipulation or massage or exercise, those are the physical type of things most people think of, but we might use things like physical devices to help optimize lung health, or we might use electrotherapy. We tend to be quite good at explaining things to people in terms of what's wrong with their body or how their body isn't working as well as it might, and maybe how they might get the best out of it. So we spend a lot of time doing education and advice with people. And we try and be holistic. So that means we take a whole person approach. And we don't just look at one tiny problem, we try and look at the bigger picture. And at the core of what we do is try and involve the patient or the person or the service user. We try and involve them in their care so they understand the choices they've got and what they can do to help themselves and what their expectations should be. Okay. Both Mairead and I really are specialists in respiratory physiotherapy. We've done the other stuff as part of our earlier working lives, but as the years have gone on, we've really focused down and specialized in respiratory physiotherapy. And again, respiratory physiotherapy, a lot of people think it's banging the chest, so just whacking the chest to try and move secretions. But there's a little bit more to it than that. So yes, we try and help people move secretions out of their chest. And that's a big part of what we do. But we might try and get a bit more lung expanded. We might try and optimize the matching of where the gas is going to where the blood is going around your lungs, so it's easier to get oxygen in and carbon dioxide out. We'll try and help you relieve wheeze if we can, so bronchospasm. and we'll try and make breathing a bit easier for you. So whether it's less painful or it's more gentle, less work, we'll try and help with that sometimes. And in terms of sort of medical problems, we try and reduce the risk of pulmonary infection. So if you can clear your secretions better, you're less likely to develop infections. So that's fewer courses of steroids or antibiotics, or importantly, trips to hospital or stays in hospital. We try and make sure you're getting the best out of your lungs and keep them as stable as we can, so that you're as good as you can be for as long as you can be. And that's, generally speaking, what respiratory physio is aiming to do. So I'll pass you over to Mairead to tell you a bit more about the kind of things that we get up to. Okay, thank you.
Hello everyone, thank you Phil for that lovely introduction. My name is Mairead Hughes. I'm one of the specialist physiotherapists that works at the National Aspergillosis Centre, and I'm just going to talk through some of the physiotherapy interventions at the National Aspergillosis Centre. The aims of my talk are basically to identify some experiences you may have while attending the National Aspergillosis Centre here in Manchester when you see the physiotherapy team. I guess the idea is to create some food for thought and see if physiotherapy is something that could help you identify some problems, set some goals, and put a plan in place as to how we help you improve on those problems, and also hope to just identify how you might access physiotherapy. So this slide here is an overview of some of, but not exclusively, the physiotherapy interventions that we do at the National Aspergillosis Centre. The first one they have there, sputum induction, chest clearance, inhaler review, nebulized therapies, management of breathlessness, energy conservation techniques, exercise support, including pulmonary rehabilitation or one-to-one input, education, and of course onward referral to other physio specialists who may have more experience in other fields more appropriate to your problem. Our first slide here is just a little information about sputum induction, and as I'm sure you're aware, it's a very important diagnostic tool to grow culture the sputum that you produce. It may help us guide your treatment decision making, and sometimes patients struggle to move phlegm, so we can do a range of physiotherapy techniques. We may also give you some medication through a nebulizer in order to get a suitable sample. If you're usually very productive and you're attending clinic, you should bring a sample with you from that morning, if that's when you're most productive. Physiotherapy also helps with optimizing chest clearance, or what used to be known as lung hygiene. I guess there are many techniques and each is individually tailored to the patient. And here at the National Aspergillosis Centre, we review patients individually and give them a technique which optimizes the clearance of their chest, reduces excessive coughing, and stops them from getting very tight-chested or wheezy. This can be through breathing exercises, or it can be through some devices like you may see here in this next slide. These are what we call oscillating pep devices. There are so many things on the market now. It is really important that if you wish to start something like this, that you do it with the support of a healthcare professional. These things can be bought online, and there are other ones on the market. So please do contact us if you want any advice or help in choosing a device that may work best for you. We go through inhalers and we use resources that are out there for patients. Some folks can't manage to breathe as fast or as deeply as they need to for their dry powder inhalers, or they need a bit of technique reinforcement, and we can go through that. One of the take-home points from all all inhaler reviews I do is that the puffer inhaler, so this metered dose inhaler, all of these should be used regularly with an aero chamber. I'll quickly point to my next slide. The first picture in the slide A is someone using a puff inhaler or a metered dose inhaler, and they are using it without a spacer. And this green shows us the higher density of the drug on this image. And we can see that the lungs have some of the drug in there and the airways have some of the drug, but the highest density of the drug is actually in the mouth and down here in the stomach. B, this one, is when they use a aero chamber or a spacer or a valved holding device. And what that does is it allows you to breathe the medication in more deeply, more effectively, losing less of it to the mouth and into the stomach. And you can see the outline of the spacer there as you follow the airways up. And there is drug deposited on the spacer, but much more in the lungs themselves. The third one here is the style of the Spiriva Respimat inhaler and how that soft mist gets in there and gets deeper. Okay, take home point, use your aero chamber. If you don't have one or would like to go through inhaler technique, you know where we are. All right, so lots of people consider nebulized therapy, and we help establish patients on that. So if you are going to start on a nebulizer, you will have discussed that already with your doctor, who you see at clinic, and we will then help you to learn how to use all the kit, to make up the drugs, to store the drugs properly, and also to fit it into the right part of your regime with regards to inhalers and chest clearance and so on. We also can help folks manage their breathlessness. We can assess what is driving the breathlessness. Is it deconditioning, weakening? Is it progression of lung condition? Is it what we call dysfunctional breathing patterns, or a breathing pattern disorder where the lungs aren't quite aware of what they're doing and need a bit of help with breathing exercises to get back on board? Exercise is another key part of maintaining and improving physical lung health and also our mental health, which is a very important part of our generalized well-being. I guess as Phil mentioned, Phil, we have to make the most of what you've got, teach you how to use it, and if possible, help you to progress and get stronger. There are lots of wonderful resources online about exercise. If you want to read around, the British Lung Foundation is a great place to start, but please do contact us if you would like any specific one-to-one advice, or if you'd like referral to an exercise professional near you. Your GP can and is the best person to refer you to pulmonary rehab. So have a little read up about that on the British Lung Foundation website, and if you think it's appropriate for you, your GP can refer you there. Education and knowledge is power. I guess understanding your medical condition is, for me, a very key point in collaborative healthcare, in the therapist and the patient coming up with joint plans and joint goal setting to make your activities of daily living much more controlled and thought out. Often I find patients get on board with chest clearance or exercise or inhaled medications when they have a good understanding of what is being asked of them and why. So please do ask us questions and use us for education as well as all the other things we've mentioned. I've mentioned onward referral, and sometimes our patients need help from someone who is more specialist in another area, and I've put up 4 examples here. Recently I referred someone who had chronic cough, and that cough was causing them to leak urine when they coughed due to the excess pressure on the pelvic floor. So I was able to refer that person onto pelvic health specialist to help with that. We have patients who we've referred into chronic pain management programs, patients who we've asked cough clinics with specialist speech and language therapists to look at their upper airways. And most recently, again, someone referred someone for home-based physiotherapy who had attended the centre, had recently been discharged from hospital and was feeling very weak and not able to manage at home. So there's plenty of options as to what physiotherapy can do, and if it's not within Phil or my remit, then we can make sure that whoever is able to help you can do so locally. Again, if you want any input, you can access through the National Aspergillosis Centre, myself and Phil there with the lovely Carol and Jenny. You can ask our medical team, you can ask the nursing team, but also your GP and respiratory consultant can refer you locally for physiotherapy input, and we can help support you remotely, or we can refer you to a local service. Try to keep that as short and sweet as possible. Describe some of the experiences very briefly. Hopefully I've created some food for thought. Again, our aim is to help you live well, and hopefully from that talk you're now able to identify how you can get in contact with Phil or myself, or how you can be referred to local services through your own healthcare providers. I am going to take this moment, and I just realised I've just gone over my 10-minute mark, to shamelessly plug that I will be running the Manchester Marathon on the 3rd of April this year. I decided with 10 weeks to go that was a good goal, and it's a very measurable goal. So in 10 weeks' time, I will be running the Manchester Marathon, all 26.2 miles for the Fungal Infection Trust. I will ask our communications team to share the Just Giving link. I'm very proud to be a physiotherapist, and I'm even prouder to work as part of the National Aspergillosis Centre and help patients who are affected by fungal infection. Thank you for taking the time to listen. Again, I appreciate it's a long old day. I hope this has given you some food for thought, and I am more than happy to answer questions directly. This is my email address. So should you wish to access physiotherapy or access my brain for more information, please feel free to drop me a line. That's my email there. Thank you all very much for taking the time to listen, and I hope the rest of your day goes wonderfully. And think of me on the 3rd of April.